Hello, I'm Dr. Brandt Gibson, and today I'm going to talk to you about the next type of nerve treatment for managing peripheral neuropathy. So if you remember, what we're talking about for the next several days is how to manage neuropathy symptoms, whether it's the numbness, tingling, pain, electrical shocks, whatever the pain is, there are ways you can manage it. We talked about yesterday the re-education process where you're taking a nerve that is not functioning like it's supposed to and teaching it how to send the correct signals to the brain and teaching the brain how to receive the signals in such a way that it understands what's going on. So in doing this, you create a re-education process. Today, we're going to talk about the next one, which is nerve reset. So I guess the easiest way to explain this is to take a step back. When I was still going to Brigham Young University as an undergraduate student, one of the things I did was I worked for a company called Dentrix Dental Systems. And as a employee there, initially my job was in support. And if you've ever called a computer support place, the first thing a lot of times you'll do when the computers aren't working like they're supposed to is you say, okay, let's reset the computer. Sometimes it's as simple as shutting the computer off, turning it back on, and that can reset it. What if you could do the exact same thing for your body? You say, okay, these nerves aren't working like they're supposed to. Let's reset them. Let's turn them off and turn them back on. It doesn't work that way. There's not an easy way to do that. And so we reset in a different way. A lot of times when you have certain types of nerve pain, they'll use a TENS unit, a form of electrical stimulation. And what it's doing is resetting those nerves. It's helping reset those nerves. To really function correctly, you need much higher voltage than, say, a TENS unit can do. TENS units usually function at about 400. And so we use a machine that's called a Neurogenics that actually works at 40,000. But what it's doing is it's taking that nerve and it's resetting it. So it's depolarizing it and repolarizing it to cause it to work more like it's supposed to. And over a series of multiple treatments, as you depolarize and repolarize the nerve, it gets to the point where the nerve starts to function like it's supposed to. You start to get the feeling back. You start to have less symptoms and less pain. And the nerves, instead of working really slowly, or working at a normal rate, or instead of working where they're not sending the signals, they start sending the signals they weren't sending. So by resetting the nerve, you're actually causing it to improve the symptoms that you're having. Does it fix the problem? It does a little bit, but the real truth is to really function, you need to do more than just reset. So you're resetting the nerve and then you say, okay, I'm now managing those symptoms. Let's do something to keep from re-injuring that same nerve. So that would be the next step after managing, is you control the damage so it doesn't keep happening. So, as a recap, you have symptoms, they're interfering with your life, you get the disability and discomfort that comes with those, and even the distraction that may come with those. You're saying, okay, by resetting the nerve, you can actually modify those symptoms in such a way that allows you to continue to do your normal activities so you can take the next step. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget.